Hello everyone. Today I will be talking about beta blockers, and there are two types of beta blockers, beta 1 and beta 2, and they are selective and non-selective. The non-selective ones, beta 1 receptors, are present in the heart, whereas beta 2 are present in the lung. So we need to be very cautious in prescribing these drugs to the patient who have asthma or COPD, because the real purpose of these antihypertensive drugs is to decrease the workload on the heart. And actually, as I said in the calcium channel blockers, that they reduce the heart rate, they reduce the force of contraction, they reduce the conduction of beats. So this is same, it goes for the beta blockers as well. Okay, so as you know that the beta blockers, they decrease the resistance. Okay, they decrease the workload, they decrease the cardiac output. So the thing is, these non-selective beta blockers, cardioselective, you could say non-cardioselective beta blockers, they not only block heart, but they will also narrow bronchi and may cause bronchospasm. So that's why they are contradicted in asthma and COPD patients. Okay, so we have these non-selective beta 1, beta 2, and I have the drugs over here. That is nadolol, propranolol, timolol, and sotalol. So all these beta blockers will end in LOL, lol, but they are not of a thing to be taken as a granted. We need to be very cautious while giving these drugs because, as I said in the previous videos, that when you are prescribing a beta blocker or any hypertensive drug, you need to observe two things. First of all, as I said, the ACE inhibitors and ARBs, they don't lower the heart rate. In fact, they lower BP. But your beta blockers, they will lower the heart rate as well as the blood pressure. So our aim to give this drug in patients whose heart rate is not lower than 60 and their blood pressure not lower than 100. Okay. So we don't give these drugs in patients who have these symptoms. Okay, or else it will cause orthostatic hypertension. Next thing, whenever we are prescribing these drugs to the patient, we will definitely observe the patient and ask the patient to have slow position changes, or else it will cause immediate hypertension to them. Okay. Now, the thing is, then we have these beta blockers that are mixed beta 1, beta 2, and alpha 1 receptors. Okay. So, what they do is they will cause vasodilation due to blocking of alpha 1 receptors. Okay, and we have these carvedilol and labetalol. Okay, the most important thing is with reference to angina. I don't want to discuss the anti-anginal drugs, but I will just take the thing to the very superficial stuff. That is, if a patient has retrosternal chest pain, complains that's actually the anginal pain the patient is experiencing, and the blood pressure you note is really lower, like let's say it's 90 millimeter of mercury by 60. Okay, so at the moment we are not prescribing that patient nitrates. Okay, the reason is because if we prescribe nitrates to the patient, this will cause vasodilation and will heart has to work a lot to pump the blood. Okay, so at that thing, this will be a really bad for the heart who is going under ischemia. Okay, so then we have these cardioselective beta 1 blockers which are preferred in angina, MI, and certain types of arrhythmias. Okay, but the thing is, these are dose dependent. Now, as I said in the beginning, I said if a blood pressure is lower than 100 systolic, so this means you cannot give because this will lower the blood pressure more, right? So right now it's your work to think what will be the suitable drug in patient whose blood pressure is lower, like 90 by 60, okay? And we are prescribing what drug we should prescribe him, nitrates or beta blockers, okay? Because you know the contraindication of these drugs, okay? So next thing is like these drugs, the most important thing you need to know about the side effects, okay? The side effects will be uh, this cause edema, you will have worsening crackles in the lungs, okay, and may cause GVP only in patients which have heart failure, reduced ejection fraction heart failure, okay. If a patient comes to you and his blood sugar levels are below 70, we don't we will discontinue this drug, beta blockers. Why? Because beta blockers have a characteristic of hiding the symptoms of hypoglycemia, okay, so they that will be not prominent over that, okay. So this is what about the beta blockers. um, I hope you would like the video, and is there anything, please let me know. I will definitely add up in the next video. Thank you.